Good afternoon, Chairman Wayne, and good afternoon, Lions of Multiple District 22. My name is Dr. Judith Goldstein, and I am the Director of the Lions Low Vision Research and Rehabilitation Center at the Wilmer Eye Institute at Johns Hopkins. I am a doctor, a teacher, and a researcher in low vision rehabilitation. And as the new director of the center, I have the privilege of providing the Wilmer update this year. And although it would be great to do it in person, I'm grateful for the opportunity to share some of the exciting work and progress we have made in Wilmer at the last year. Today, I would like to share specifically our advancements in teaching and education at the Lions Low Vision Research and Rehabilitation Center. So quarantining this year has provided us much more time to consider our priorities, especially as it relates to teaching and education. The pandemic has forced us to consider how we teach, how we communicate with mentors and mentees, how we share our scientific work, how we write our papers, how we interview fellowship candidates remotely, and most importantly, we've learned how to turn on and off our mute button. We were thrown into this situation of the pandemic unexpectedly, and I'm very proud to state that we have been effective in learning new ways to teach, to plan, to be creative, and be flexible in our educational program. So our educational program expands to many different users. We educate clinicians, researchers, trainees, both ophthalmology residents, fellowship candidates, sometimes students of optometry. We may educate Lions members, community members, and even state agencies. So we have many audiences for our education. And as everyone knows, it's very important to gear the educational component to the group that you're talking to. And that's where we have really made a big effort to focus this year on who is the audience and how do we best educate. So one of our audience are peer clinicians. And this year, we had the opportunity to participate at the Low Vision Center at the 14th Annual Evidence-Based Optometry Conference on Sunday, March 7th. And this year, myself and Dr. Weinberg participated with Mindy Kaplan from Foundation for Fighting Blindness as part of this conference agenda. I spoke to our peers about the magnitude of refraction improvement in people with ocular disease. Should you essentially bother to check the prescriptions of patients who have vision impairment? And Dr. Belinda Weinberg spoke about driving and low vision and gave really a fantastic talk about how to evaluate patients as it relates to their function and the legality of driving in the state of Maryland. So very successful virtual education this year to our peer clinical doctors. Dr. Weinberg, who is relatively new to our service, has actually taken on some other mentorship responsibilities. She will be serving with me this year as Division Education Champion on the Residency Education Committee. This becomes particularly important because we must make sure that our ophthalmology counterparts who are seeing these patients with low vision are effective at identifying these patients and getting them connected to service. We also focus on ophthalmology resident and faculty education through our Grand Rounds programs, our didactic programs, the rotation of the residents through the clinical services, and most recently this past year, due to the pandemic, we now have our ophthalmology residents participating in Journal Club. So as part of their rotation through the clinic, we help them where they choose an article, a scientific article, typically something that relates to their interests or the work that we're doing, and presents on that article. And we're not only talking about the technical aspects of the article, but the research quality, the findings, and is the outcome of that research article inform us about future research opportunities in a given area. So not only have we had the opportunity to evaluate and teach and train residents, but the residents at Wilmer also have an opportunity to evaluate us as faculty. So I would like to share with you here our scores this year from ophthalmology residents on the low vision service. And we did a really fantastic job this year getting 4.9 out of 5.0 on both the didactic teaching side and on the clinical side. And we're very proud of that. Most of the divisions did very well, and we are right up there with retina and glaucoma and many of the divisions that are larger and perhaps a little bit more familiar with the interests of ophthalmology residents given their surgical interests. Other forms of education this year that we've been involved with. Most recently, in early May, we were involved in teaching our research counterparts at the Association for Vision Research in Ophthalmology meeting this past May. And I'm very proud to report that so many of our faculty, postdoctoral students, fellows participated at the research meeting. Dr. Nguyen, Dr. Kanjapad, Dr. Deemer, Dr. Danieli, Dr. Guo, Dr. Kartha, and Dr. Sajedi. So we all work in different areas, but to be able to go to a meeting and present our current research and get feedback from our colleagues is essential to improving the work that we're doing. And so for our low vision fellow education this year, it's been very important throughout the pandemic to make sure that they continue to get the elements of the education that they had in person during prior years. And this year our fellow did participate in grand rounds twice, participated in our daily clinical teaching, as well as research. And many of you are familiar with Dr. Hang Nguyen, who has been our fellow 2020-2021. And what's great about our fellowship teaching program is the fellow is both a mentee and a teacher. So the fellow has the opportunity to teach other faculty because they are becoming the expert in the field. During the pandemic, when we were not seeing patients for a short period of time, we had an opportunity to revamp our fellow curriculum and our review process. And this year we'll be rolling out our pilot review process. We did this at Dr. Nguyen's 6-month mark, and we'll be doing it at her 12-month mark. But one of the things that we've learned is that feedback is critical to development of a clinician, educator, researcher. Right? We have to know how well we're doing and where our areas of deficiencies are in order to be able to improve our skills. We were fortunate this year to put on 2 virtual grand rounds. The first grand rounds was moderated by myself and Dr. Neil Miller, who is a neuro-ophthalmologist at Wilmer, and our second grand rounds was moderated by Dr. Robert Chan. In both cases, we had participation from Dr. Nguyen, our fellow. In the first time, she co-presented with neuro-ophthalmologist Dan Gold. In the second grand round, she presented on a very interesting patient that she herself had followed. And so, as I mentioned, teaching clinicians is essential to becoming an educator oneself. And so our past low vision fellows, many of you are familiar with, and Dr. Nguyen represents our 8th low vision fellow. And we're very proud of the work and the efforts that she has put in this year, and the efforts of our faculty, Dr. Massoff, Dr. Chan, Dr. Weinberg, myself, Kristen, and Jim, to improve her skill set and to become a clinician educator. And so what I'm happy to share with you is the next phase of our training and education program. Dr. Dominic Brown will be joining us at the end of July of this year. He is our 2021-2022 Lions Low Vision Fellow. And he shared with us a little bio that I would like to share with you. He says that I'm a Baltimore native who studied at the University of Maryland in Baltimore County, majoring in a bachelor's degree in biology. I went on to obtain my Doctor of Optometry in 2020 at the Pennsylvania College of Optometry at Salus University. I completed my residency training at the William Feinblum Vision Rehabilitation Center in Low Vision and Ocular Disease. Now I'm humbly enthused to begin the Lions Low Vision Fellowship Rehabilitation Program at the Wilmer Eye Institute at Johns Hopkins Hospital. I love the field of low vision as it truly optimizes how patients functionally utilize their remaining vision. I'm very excited to explore low vision rehabilitation as a clinician scientist and learn new and meaningful ways to continue to make a difference in the everyday lives of patients. So I look forward to many of you getting to know Dr. Brown. I think he is going to be an incredible addition to our program in the upcoming year. And so it's time to renew our commitment to teaching and education. We have spent a great deal of time this past year enhancing our program and enhancing the partnership between Wilmer and LVRF. Many of you know that our fellowship program requires annual contributions from Lions Vision Research Foundation to keep the program going. So each year the Lions have to raise money to support the fellow for their year in their education. The endowment that we have put together, the arrangement between Wilmer and LVRF, ensures sustainability of that training program, because it will not be feasible to continue to raise $100,000 every year in perpetuity, perhaps. This endowment is to be funded by Lions, Wilmer, grateful patients, and individuals dedicated to ensure the training program continues. And so in sustaining our commitment to education, we organized a $2.3 million partnership between Wilmer and LVRF. The partnership is such that we will both work together to fundraise. And our fundraising committee that we have developed is working hard to guide this effort. And to date, we have raised a little over $500,000 towards our commitment to the endowment. And so our training program has had international recognition and international effects. And our goal is to continue to train clinician scientists to care for individuals with vision impairment. And to date, we have low vision clinician scientists in Thailand, California, Massachusetts, Connecticut, and Maryland. And we will wait to see where Dr. Wynn lands, but I'm very happy and very pleased with the footprint that the educational program has had on the care and delivery of low vision services to patients across the United States. Thank you, Lions. Thank you for your continued support of our educational program. As you know, without you, we would not be able to have the impact that we have. So we are very grateful for your efforts. Enjoy the rest of your virtual convention, and thank you again for all your hard work and service.